Good morning, good day, colleagues, and welcome everyone who's just joining us. Thank you for joining us, and welcome to the regional roundtable for the Ubuntu Symposium. And this is a roundtable today that is focusing on the impact of COVID-19 stimulus packages in Sub Saharan Africa and its effects on gender-based violence interventions. My name is Mbiwa Mangwiro Tanga. I am from Sonke Gender Justice, which is also the Secretariat for Men Engage Africa, and I am going to be your host. I'm going to be the facilitator for our roundtable discussion today. Before we proceed, I'm going to kindly request that anyone who is not speaking, may you kindly keep your microphone on mute so that we are not disturbed by other sounds. And I'm also just going to kindly request that you bear with us while we give a few more minutes to allow other participants to join in. Thank you. We should be able to proceed at 9:05 and begin our process. Welcome, everyone. Thank you for bearing with us while we were still allowing in more participants. We are now going to proceed. And as earlier on noted, thank you for joining us. This is our the Africa Regional Roundtable discussion. And today we are looking at the impact of COVID-19 stimulus packages in Sub-Saharan Africa and its effects on gender-based interventions. And looking at this roundtable, looking at this discussion has been really influenced by the fact that the reality is that since the global outbreak of the coronavirus and the ensuing lockdowns and the many interventions that we have seen happening since the coronavirus was, since we had this global pandemic, many countries have seen huge increases in different forms of sexual and gender-based violence, including intimate partner violence. Alongside the deepening socio-economic factors, the restrictions on movement and isolations, there has been a rise in the violence that has been experienced against women and girls. Whilst women have been forced under lockdowns with their abusers, services offered in support of intimate partner violence and domestic violence have remained inaccessible and in some instances disrupted. These multiple layers have exacerbated considering competing limited resources, services, and government's responses to the pandemic. So this discussion is part of a regional roundtable that is really focusing on the gendered impact of COVID-19 and its effects, and the effects that initiatives aimed to address it, such as the various stimulus packages that our governments across the region have embarked on, what these have had, the impact that these stimulus packages have had on GBV and gender equality. This is what the purpose of this roundtable discussion is focusing on. So we have invited partners from regions where a research that has been commissioned by Sonke Gender Justice are coming from, and this research is really focusing on the impact of the stimulus packages in the sub-Saharan region. And this research is looking at 6 countries, which is Zimbabwe, Rwanda, Sierra Leone, Kenya, Mali, and South Africa. So today we are joined for this discussion by participants from these countries, together with the researcher that we commissioned, so that we can have an opportunity to discuss, to engage and explore and really unpack and understand what the gendered impact of the coronavirus has been, but over and above to also understand what the effects that the stimulus packages that our governments across the region and particularly in these countries have been. So joining me today are partners from the 6 countries who are part of Men Engage Africa, who are part of the Men Engage Alliance, and we will be joined. And before I hand over to our researcher who's going to give us an overview in terms of what the picture has looked like within the African region and within the African context in terms of COVID-19 and its gendered effects. So I'm going to briefly introduce some of our participants today who will engage with us. We have Florence Mutaka, who is a programs coordinator with Shamwari Yemwana Sikana, which is a leading girls' rights organization working to empower, educate, and advocate for girls' rights in Zimbabwe. Also part of our panel is Nakai Godfrey Nengomasha, who works for SAF AIDS and is also the Men Engage National Coordinator for the Zimbabwe chapter of Men Engage Africa. We also have David Tamba Makeo, who is the founding executive director of Men's Association for Gender Equality Sierra Leone, which is also the secretariat for Men Engage Sierra Leone. We also have Kosum Kolibali, who is the national coordinator for Men Engage Mali. And also joining us is also Michael Onyango, who is the executive director of Movement of Men Against AIDS in Kenya. And also we have Angie Marie Yvette Nira Sambimana, who is Youth Engagement Program Coordinator at Citizen Voice and Actions, Rwanda, and Rwanda Men Engage Network Youth Coordinator. We want to extend, and also we have Sibonelo Ncube, who is the researcher who has been commissioned to conduct the research we have mentioned. So we want to welcome all our participants and thank you for the fruitful engagement that we are going to have on this very important conversation. I am now going to hand over to Sibonelo Ncube, who is going to give us an overview in terms of how the picture looks like when we are talking about the gendered impact of COVID-19 within our region, within the African context. Thank you.
Thank you very much, Piwa. Good morning, colleagues. As Piwa has already mentioned, my name is Sibonelo Ncube, and I am the researcher who will be leading today's discussion. I'm just going to share my screen and just briefly give an overview of the situation, the current situation in terms of COVID-19. And its gendered impact. So this presentation is going to be very brief. It comes from the literature review that we did. And in the interest of not unpacking our discussion today, I'm just going to give a rough overview. Piwa, can you see my screen?
Yes.
Thank you. On the first slide there, what I have is an overview of COVID-19 infections, in the world, but obviously we are focusing on Africa, and I got this from the WHO website. Just to show the extent of the problem, and maybe the picture is small, and you can't see properly, but what is showing there is that over 106 million people globally, over 106 million cases globally of COVID-19 have been reported as of yesterday, 9 February, with over 2 million deaths to date. And also with Africa having over 2 million confirmed cases since WHO started reporting on these statistics. So we have a situation that is bad and that has gotten out of hand in terms of COVID-19 worldwide and in Africa. So what we've seen is the destructive effects across social and economic spheres in terms of women and girls. What we are also seeing is what has been termed a global recession, where more women are losing jobs during this COVID-19 induced recession. And this is really because the female dominated service sector jobs were amongst the first to disappear as we all know, that schools were closed, childcare centers, hotels, restaurants were shut down as different governments attempted to respond to the COVID-19 pandemic. And because women are more likely to have jobs that have a lot of human interaction, that makes social distancing quite difficult. And besides women losing jobs, in terms of the devastating effects, we've also seen that even those women who did not or who have not lost their jobs have been disproportionately affected, because they have to, because if childcare centers are closed, it means that those who have jobs have to work from home, and then they now have to juggle work and having children who are being homeschooled at home. So they now have to juggle both those things, work and children. And this will obviously, or may obviously, affect their productivity and maybe even their career prospects. What we've also seen is that the states try to respond with policies, state of emergency, lockdowns, but also stimulus packages to help cushion the people from the effects of the COVID-19 pandemic. But yes, there have also been unintended consequences, as from our literature review, we saw that there's a spiking levels of gender-based violence across all the countries that are part of the study. For example, in South Africa, we've seen an increase in calls on their GBV, gender-based violence hotlines. Singapore and Cyprus also saw a 30% increase in gender-based related calls on their GBV hotlines. So the situation has affected women in terms of like economically, but also in terms of the levels of gender-based violence increasing. On my next slide, I just gave a few examples. I don't want to preempt, so I'm going to be quite brief, and I just picked Kenya, South Africa, and Rwanda, just to give a map or an outline of what happened right from the day the first confirmed case was reported. So in Kenya, the first confirmed case was on the 12th of March in 2020. And how the government responded was that it established a national response committee and then ordered a lockdown restriction, curfews, there were school closures. And by the 25th of March, the government announced a stimulus package, which included 100% tax relief for gross income at 24,000 shillings, and then reduction of income tax, and dedicated 10 billion for social protection. In South Africa, the first confirmed case was on the 5th of March, 2020. The government of South Africa announced a nationwide lockdown on the 23rd of March. Schools were closed. Only essential services could operate. A state of emergency was declared, and a National Command Council was created to deal with the pandemic. And then in terms of the stimulus package, it was announced immediately after, and the focus of the stimulus package in South Africa was on protection of jobs, social grants, PPE, and the government also established a solidarity fund to cushion the citizens. In Rwanda, 14 March, that's 2020, that's when the first case was confirmed. A joint task force was established. There was a hard lockdown and restrictions on inter-district movement and the movement of people within districts. And Rwanda chose a multi-sectoral response to the pandemic, and introduce an emergency COVID-19 relief package from the World Bank. We will hear more about this from the participants from each of the individual countries. And I only have Kenya, South Africa, and Rwanda here, but we know that we have other countries that we'll be focusing on. So the thing is, what we want to find out from this discussion and from the research is whether the response in terms of the stimulus packages, or maybe they were not called stimulus packages in other countries, any economic relief measures. So was there a gendered approach to that? And so what we know from literature is that women, because women are the primary health caregivers, And as I've mentioned, the school closures and the increased household tasks have obviously increased the burden of care on women. We also know that a big proportion of women work in the informal sector, and the informal sector was like first to be affected by the lockdowns and the shutdowns and the restrictions of movements. And also what I've already mentioned, that women have to juggle the multiple roles, which increases their vulnerability in terms of their productivity, career prospects. We also know that poverty has a feminine face. So more women are pushed into poverty and sexual exploitation. And we also know how different pandemics tend to affect women and tend to push women more into poverty and tends to push them into seeking precarious work. And then with COVID-19, there has been a disruption of life-saving care. So the sexual reproductive health and sexual reproductive health and gender-based violence has taken a sort of a second or back seat due to the pressures in the healthcare system, as healthcare workers focus more on COVID-19 cases and the pandemic. So we've seen a disruption in terms of the services given to women, their sexual reproductive health care, and also gender-based violence care within the healthcare system. And then I've mentioned already that there has been an escalation of gender-based violence from our literature review in all of the countries. There have been reports of increased gender-based violence. And overall, COVID-19 has amplified the existing inequalities. So before I get into the questions, which then unpack some of the things that I have, or seek to unpack some of the things that I have already addressed here, I'm just going to give over to you, Mpiwa, before I can proceed. Thank you.
Thank you very much, Sibonelo, for that overview that you have given, which certainly paints a picture of a gendered dimension and a gendered impact of COVID-19. But of course, it remains to be seen in terms of the rest of your research and the rest of the process, whether to what extent this gendered impact was and what exactly or what form that it took. But thank you for giving us that that overview and for painting that picture. And I am going to request that colleagues kindly note that at this moment we are going to then continue the conversation where we are going to have our researcher engage with our participants who were earlier on introduced, so that they could share experiences from their own countries and from their own context. But we're also cognizant that we have people who are also coming from these countries, participants who are coming from Kenya, Rwanda, Zimbabwe, and all over other countries. So if you have any contributions to make in addition to what the participants give to the questions that are going to be presented as we continue with this discussion, please kindly put your questions or your comments in the chat box, and we will engage with them once we have gone through the process of the discussions and what our participants have got to share. So thank you very much. Make use of the chat box. Put your questions, put your comments, your additions to the information that is being shared on this platform. So I will hand back to Sibonelo to now pose the questions that are going to start the conversation with all our participants. Thank you.
Thank you, Mpiwa. So what we want to find out now is the experiences of each country that is presented by the participants in terms of the impact or the effects of COVID-19, but with particular reference to the stimulus packages or the economic relief measures in each country. So I'm just going to ask, I have about 6 questions that I'm going to use to lead the discussion. And the first question, where is it not moving? Oh, okay. So the first question from what we seek to, what we want to find out is, how have women and men been affected by the COVID-19 pandemic in your country? So don't get into the stimulus packages yet, but we want to know how women and men have been affected by the COVID-19 pandemic in your country. And maybe because I'm in South Africa, I'll just start with South Africa. Can you hear me, colleagues?
Thank you for posing that question. At this moment, would require that you move on to another country since there has not been any another response.
Oh, okay. Rwanda. Thanks, Mpio. Rwanda.
Thank you. I'm Ange-Marie Yvette Nyansedmana from the Rwanda Men Engage Network, and I'm the youth coordinator. As the first question asks, how have women and men been affected by the COVID-19 pandemic in our country? Of course, over the world, you can't neglect that the COVID-19 has mostly negative effect, but in our country, we also have been having testimonies. It also had some positive impact on women, mostly on their unpaid care works or home works. Men on the effect of the COVID-19 on women, of course, there was an increase of GBVs, gender-based violence, and IPVs, intimate partner violences. This you can see on the report of the Rwanda Investigation Bureau. If you search, you see that the statistics, and on the gender rapid analysis done by Plan International Rwanda chapter, we see that there was increase of gender-based violences and increase also of teenage early pregnancies. And what I said as a positive effect is that due to lockdowns, all activities, at most all activities were closed and people were staying home, some men realized that home works are not too easy to be done as they expected that it was. And they have been changing minds that though we expect women to stay home and do all the activities, but the activities are burdening. And they changed mind and they say that we can help also our sisters and those who are married, and then they decided to help their partners. And I say that, and I saw that this is, wow, it's a positive impact of staying at home and see how's home care works done. That's what I said in the beginning, that though there are more negative effect on generalities, but there are also one I realized that it is a positive impact. And for all both men and women, there was loss of employment opportunities for those who were in informal sectors. Men lost their employment opportunities, and that led to poverty. Some families, to many of the families, for those who worked in the informal sectors, that's a negative also impact to both men and women. And I know that my colleague also, Brice, had some research, and he can continue from there and mention some also other negative or positive impact on men and women for the COVID-19 pandemic. And I hope that Bruce can add more.
Yes, thank you very much, Ange-Marie. Welcome everyone this morning. My name is Bruce Chindi. I am an author, and I'm also the president of Ruling Dorma, and I also currently serve as the deputy vice chair of the Youth Steering Committee.
I think you are breaking, Bruce.
For Men Engage Alliance. There's something to note about a moment. There's, excuse me. Sorry, can you, hello?
We can hear you now.
Okay, very well. Yeah, I think it's interesting to note that Rwanda so far has about 16,811 confirmed cases. And out of those cases, the male affected is 10,384. So that's 61.7% of males affected by COVID, and it's 38% for women affected by COVID. And that would be 6,427 people. And when we're looking at the death toll as well, there's been 226 deaths, 76 of them being women and 150 of them being men. And so I just wanted to highlight that and say there's perhaps a bit of a social a social function perspective to see, you know, how is it that men are more likely to get COVID, and are men being socially encouraged to limit the spread of the virus, which goes into detail about how communities of men now go beyond their homes and perform these sexual violence behaviors and engage in gender-based violence. And so perhaps there's a link on there about how much responsibility men feel in our communities in engaging on social aspects that concern all of us. And yeah, that's really what I wanted to mention on that perspective. And just to reiterate a few points that Ange-Marie mentioned, women and girls have been more significantly affected in terms of job security prospects. The majority of workers in Rwanda, or at least for the past 3 years, the most employed population was in daily wage jobs, and obviously they do not come 30 days a month. It's more like once in a while thing. And they were overly represented by women. And so if everything is closed down, the women and girls are less likely to find opportunities, which leads indeed into sexual exploitation and other ways that they can serve their families, especially considering the constant. Sorry, I broke off a little bit. Yes, I was saying about how the availability of of opportunities for women and men is widely there's a gap in that. And in terms of public support and government support, women actually benefit under VUP programs. So about 68% of women are involved in government social protection programs, and those participating in public works and benefiting from other financial services are around 52%. And I actually have a bit of in-person experience with this, because when you're looking at the work that NGOs do and the involvement that they do in several mediums, women are more engaged. Of course, I think the fact that women are given the responsibility to be household heads, really, in terms of just maintaining not all the life at home, and the man is just I guess cultured to be the provider, and it gives way too much, not way too much, but it gives an added responsibility to women to even engage in supporting the community. And so it's interesting to see how that looks after COVID-19. And yeah, I think that is what I have in mind so far. And of course, it cannot go unsaid that I think Ange-Marie said the increase of gender-based violence and the increase of pregnancies that have happened over the course or even during the first 3 months of pandemic. Yeah, thank you. I'll leave the floor to everyone else to speak.
Thank you, Bruce. That is quite interesting. The increase in teenage pregnancies that has been mentioned by the previous speaker, and the increase in GBV, and also what Bruce just said around men being the most cases of COVID-19 being amongst men than women. I think I'll move on to the next speaker. We're still on the same question in terms of how women and men have been affected by the COVID-19 pandemic in your country. Mali?
Good morning, everyone. Can you hear me?
Yes.
Thank you very much. The situation is in Mali is quite the same like in other African countries. What can I say that, the COVID-19 has not affected the women and men as the same way because they are not doing the same activities and at the same time as economical level, social level, and also at in political level. First, in economical level, we know that most of the women are in the informal sector, and as you know, that the market has been reorganized for a time where women are not allowed to spend more time on doing the informal activities during the pandemic period. That has affected the women very well because they are losing their revenue and incomes during that period. This is something very important I want to highlight at that point. The second point is about education sector. You know, in the country like Mali, women, girls are not going to, at school more than boys. But during this pandemic period, young girl has been affected to do some informal activities and has been exposed to some sexual violence highlighted by the UNFPA study made in 2020. What I can say also is about the situation of closing the also how to say the place where people are gathering to cultural, sports, and political activity, no up to 50%. And we know that in that situation, only men are capable to attend those meetings, and women are putting out of the regular meetings taken in that sector. So globally, the study made by UNFPA in Mali in 2020 about the consequences of the pandemic and on GBV has been mentioned that the level of GBV cases has been raised by about 49%, uh, compared to the normal time of GBV figures and facts at that period. And during this study also, it has been mentioned that there is a direct link between COVID period and the increase of GBV cases, especially in sexual violence, economical violence, and also affected by SRHR activities, because women are not don't have opportunity to go to the hospital because transportation measures has been affected by the COVID situation, and that has been a very big issue in the country. But let me highlight 4 points that has been, has been I have to say the cause of the pandemic link between gender-based violence and the COVID-19 is when men are not going to work because the work hours time period has been organized and they are spending more time at home with women. So this cohabitation with women has increased a lot of violence between men and women. Also, when women are not doing men are not doing the regular activities, they are losing incomes, of doing the activities, and that has affected a lot the situation of the GBV in the families. And also, women, as already related about child marriage, because women young girls are not going to school for a period, and that time, families are deciding to give the child to marriage. So the child marriage has been increased that during this period, and also violence against children has been increased also in that pandemic period. So with this some point we can say that, but globally, women have been more affected by the COVID situation than men. Thank you very much. In Mali.
Thank you very much for that response. Please say more about the sexual violence experienced by girls. Is it also due to the fact that they are not going to school anymore? Because you say that in Mali already more boys than girls go to school, and that now, yeah, just if you can just expand on the sexual violence that is experienced by girls.
Yes, there are two ways we can look on that situation. The first that I said, women, when young girls are not going to school and they have been exposed to some small business, informal activities during, the pandemic period, and going to do that small business, they have been, abused by some clients who are, in that situation. This is the first point. The second point, the place where we got nightclub has been closed for a time because they closed the nightclubs and the cultural space. And men who are going to that place, to have some sexual relations outside the house, has not got any situation like that. And they come back to their family and their relatives who are girls, who can be the cousins, the girls, and the daughters, and the young women who are working in the houses has been affected by those sexual violence inside the family. And the last point I said that is about the child marriage, because if they are not going to school and they are still at home, we are in a country where we have 95% of Muslims in that country. And people, about the Maputo Protocol, we are the only country in Africa where the age of marriage is 16 now. And you say that in this religious context where the religious leaders have a big influence in the society, the young girls are going now to go to marriage earlier, and so they are affected that this situation also. This is how I can say that. But lastly, what I can say in that situation is that generally, when I mention about the difference between the rate of girls going to school from boys, it's about more than 20% the difference between the two rates. So this is something very important we need to see. Maybe in the recommendation we will see how to have mitigation measures at that education level. So this is another situation we can mention on that time. Thank
you. Okay, thank you very much. So that was Mali. Increases in sexual violence experienced by girls, women being affected economically because most of them work in the informal sector and with lockdowns and shutdowns, and increase in GBV cases with men spending more time with women at home, and also an increase in child marriages and violence against children. I'm going to ask the same question to Kenya. How men and women have been affected by COVID-19 pandemic in Kenya?
Good morning, everyone. My name is Michael Onyango from Movement of Men Against AIDS in Kenya, which is a member of the Kenya Men Engage Alliance. I would say the effect of the pandemic in Kenya impacted differently to both men and women. This was due to measures put in place to curb the spread of the pandemic by the government, such as social distancing geographical containment, lockdowns, and the looming uncertainty about the disease, which had adverse effects threatening lives and livelihoods of both men and women, especially people living with HIV and affected communities, drawing back on gains made in various fronts. Livelihoods of people with disabilities and people living with HIV were disrupted. Some had to go without food for days, others missed their drugs due to lack of food, and others failed to go for appointments due to lack of transport to and from the health facilities. There were fears of contracting the virus at the facilities. The stigma around COVID negatively impacted on the lives of people living with HIV and AIDS. There are also increased cases of human rights violations by the police, especially when enforcing curfew. And the pandemic posed a major gender inequity challenge at various levels of society, including the home front, where there were increased cases of domestic violence because you'd find men who are working now not working, boys who are going to school now at home idle, doing nothing, while the girls' household chores increase because of the demand that they are supposed to provide care at the home. There were pregnancies, increased cases of pregnancies among young schoolgirls, and the issues of drug and alcohol abuse among youth during the lockdown. The threat of gender-based violence also imposed a burden on care work in households, where women carried most of the burden, creating stress and anxiety. And this exposed them also to exposure to COVID. The situation deteriorated further despite the containment measures, and efforts were put in place to actually mitigate the impacts by the government, were such that those losing jobs were given tax relief, and those people infected with HIV who could not access treatment defaulted on taking the antiretrovirals, and there was also an increase of sexual and gender-based violence, especially in the detention facilities, where a lot of people were exposed to sexual and gender-based violence. I would stop at that.
Thank you very much, Onyango from Kenya. So just in summary, livelihoods were destroyed, and this affected both men and women, but especially people living with HIV who could not access treatment due to a lack of transport. Human rights violations by the police, increase in the burden of care for women, teenage pregnancies, drug and alcohol abuse within the youths, and an increase in sexual and gender-based violence in detention facilities. So that has been Kenya's experience with the COVID-19 pandemic. The last country for this question is Sierra Leone.
Sorry, Admire, just to find out if Sierra Leone, David Tamba, are you able to respond?
Maybe he's on mute.
David Tamba, I can see you are speaking, but you are on mute. Kindly unmute your microphone. Okay, we will proceed while our colleague in Sierra Leone, once they've attended to their challenges, they'll be able to respond.
Zimbabwe is yet to respond as well.
And may Zimbabwe also kindly proceed to respond, and kindly note colleagues who are also online that you can share your experiences on the chat while we still hear from our panelists. Towards the end, we will be able to engage with some of the information that has been shared and discuss some of those experiences. Thank you.
Thank you. The lockdown really measures affected both men and women, but it wasn't the same. But in Zimbabwe, most of the people are in informal sector. So because of the lockdown measures, then it affected in terms of livelihoods. Livelihoods were affected. And I think maybe in other African countries it's still the same. It is important to note that for some couples, this was the longest time that they've stayed together as husband and wife, as they were always doing other things. But the lockdown made them to stay together. And this then caused an increase in terms of GBV. And it is recorded that GBV went up. I think it went up, and emotional violence. It was the most frequent actually during the lockdown at 55%, and also followed by physical at 22%. And according to the National GBV hotline, from March to November 2020, about 6,200 GBV calls were recorded. So there was an increase in terms of GBV during this period. And other forms like psychological violence, sexual and physical violence also, they were on increase. And I'll leave my colleague to also share, to add to what I've just shared. Thank you. Florence, are you there? She's having challenges with her connection, so maybe we can go ahead.
Okay, thank you very much for that, and my apologies, I had forgotten Zimbabwe. So that was Zimbabwe. Also, just briefly, the effects on livelihoods, because the economy relies more. I mean, most people are working in the informal sector, and people staying together for longer periods of time has spiked cases of gender-based violence. As he has reported that there has been an increase in calls on the GBV, the national GBV hotline, and perhaps we would have had more from Florence as well, but I'm sure she'll be able to join us later. So I'm just going to move on to question 2. Let me move it here. Okay. So question 2 asks about the stimulus packages themselves. So what stimulus packages or economic relief measures, if any, did your government or any other entity implement to deal with the effects of the COVID-19 pandemic? And I think I'm just going to go around in the same way and start with Rwanda.
Okay, I think I could go first for this one, and Marie-Ange will assist right after. For Rwanda, what has happened? Well, I think you mentioned it earlier before about receiving the stimulus package from the IMF of about $109 million, I believe, if I'm not mistaken. However, I just want to touch base that in the very first few months, the economic incentive for digital, a digital economy were very emphasized. So for those who don't know or who have been in Rwanda, we have mobile money, and those there were reduction of transfer costs. Actually, they were completely eliminated during that time. And we saw a surge of about 457% on digital on digital economy use. And so looking at the future now on the continent as well, we are going to be to have to engage in designing effective systems to engage further on our continental trade as well as the local trade. Something else that's been happening in Rwanda right after lockdown was a bit facilitated. Of course, the government, the Ministry of Youth and Cultures, 500 million Rwandan franc package for youth entrepreneurs was given. And there are a bunch of other accelerator programs that are greatly encouraged. For example, the accelerator program of Jasiri, which is a South African based high entrepreneurship program. It's a 1-year program, and it allowed to give a bit of a, both business advisory, leadership development, as well as 10,000 seed programs, and even available for more capital for development of products or ideas. There's the Norskin accelerator package that's actually in momentum right now, and it's open to everyone wherever you may be. And so I encourage whoever's listening to look at it. And Norskin is introducing their hub on the East African region in Rwanda. And so that's definitely another opportunity for all of us to be engaged in mediating the effects of the pandemic. Food security is, presented a major challenge, especially as families in rural were unable to go to jobs. And there's obviously been a significant increase in unemployment, but there is a minimal impact in labor-intensive sectors like agriculture, forestry, and fishing. And so luckily, with the sectorial implementation of COVID restrictions, families in rural areas have not been intensively affected. At least there's some form of life still going on. And I will stop here and give Marie-Ange the floor to add whatever she may like, please.
Thank you, Bruce, for the input. And what I can add on is that on the employment-related measures, the National Bank of Rwanda extended lending facilities to banks. It gave 50 billion fund to distressed banks at a low rate, and the tenure extended to 3,006 and to 3 months, 6 and 12 months. And also the National Bank of Rwanda encourages digital payment, and from March, April and May, there was free payment. You could go for a service and you pay by Momo Pay or banking payment, and it was at a zero cost. And also the National Bank of Rwanda with other operators and banks, they agreed that merchants' fees on payment, all contactless point and say the mobile payment and all other related issues that the system was to encourage a digital payment, cashless world. And this was a thing that it developed at a rate that was, and all Rwandans should say, oh wow, we didn't know that without going with cash in hand, we could go and get service and we avoid the spread of these COVID-19 issues. And also in the reduction of taxes, what the government of Rwanda did, on the tax payment, there was amicably paying the agreement where the taxpayers could sit and discuss with the Rwanda Revenue Authority on how they could pay the taxes for the other 3 months where the population or the whole country was in total lockdown. There was also suspension of some taxes. It is real. You can find on the announcement of the Rwanda Revenue Authority. The government of Rwanda also, on the social protection, it provided food for poor families. We say that the COVID-19 impacted on the loss of employment opportunities for both men and women. So the government of Rwanda identified that poor families, of course, had the problem of, yes, food security. And the government on the social protection decided to provide food and security for the poor and needy families. And another stimulus package is that international organizations and non-governmental organizations and also local partners like Plan International Rwanda and its local partners, they decided to provide income generating activities to teenage pregnant girls, early pregnant mothers, so that they can help them to provide food for their kids. And I think it's social and also economic. And there are many stimulus packages that the government of Rwanda and other partners have been doing, but what Bruce said and what I added on, there are few of many. Maybe when we have like a wide conversation, we will be able to present all the data and also other added information. Thank you very much.
Thank you, Marie-Ange. Sir, I just wanted to add one small bit of input. As I'm sure we're all of us engaging in this conversation, and we are all engaged in achieving the mission of the Africa Agenda 2063, as well as implementing the African Continental Free Trade Area Agreement. And so in setting up a pace to recover from the pandemic, as well advance on our plans, Rwanda has established the Kigali Financial Center, and it does also involve the tax reliefs mentioned in the AFTCA, as well as other facilitation laws that are permitting many entrepreneurs throughout the continent. And so I just wanted to add that continental perspective on the very detailed and greatly impactful comments that Ange-Marie has said on the local context in Rwanda.
Thank you very much, Rwanda. Yeah, so many forms of stimulus packages coming from different sectors and different institutions. So yeah, I think this is quite comprehensive. So the package from IMF that was mentioned, money for youth entrepreneurs, food security, including assisting teenage pregnant girls, the suspension of some of the taxes and the encouragement of digital payments, and also assistance to distressed banks. For Rwanda, yeah, I think it's quite a number of packages that have been unpegged. So yes, we will continue to have the conversation even through key informant interviews, so we can expand more on some of these things. Then so let's just move on to Mali.
Thank you very much again. Before coming to the stimulus package of economic relief measure, let me tell you that Somali is in a special situation before the raising of the pandemic situation. We were in peace and security challenge against the terrorism in the country. And also, when the COVID arrived in the country, we were also in a political bad situation where we had a coup in August 2020. So we have now a state which, a country which is very, very disorganized from the government side and the local government side also. But also we can see the contribution of the solidarity of international organizations working in the country. But globally, what the government had made is linked especially to the economic relief measures. First, the government has issued a guarantee fund for SMEs who are in the financial bad situation, but not for the informal SMEs, but only the SMEs who are registered. They have been able to have the guarantee fund with about 20 billion of our local currency that they can use to support the financial situation during the pandemic time. To convert the 20 billion of our currency is about 40 billion USD as a guarantee fund for SMEs and that situation that can to support them to keep the workers in place and to support some activities during the pandemic situation. Also, what the government has said, has given to the small enterprises is to allow them to produce masks. Most of the small companies are working in the manufacturing, artisanal, and handicraft sector, and they have been engaged to produce, many, I can say about more than 1 million masks produced locally by the small companies, handicraft small companies, SMEs in the country. So, in that factor, many women who are working in that handicraft sector has been involved in the process. So I think that this is something very important for the local economy. But we know that during this situation, we have been supported by international organizations like UNFPA, like UNICEF, to support the countries where they have some challenges for schools and so on. And these things, learning has been put in place to support the students who cannot attend the school a normal way, and they have been supported by using, distance learning in that period. But also, we are in a situation where the government are also giving, how to say, money transfer to some population who has been affected both by the security crisis, but also by the COVID-19 crisis. So this is something also I can highlight in the situation of Mali. But what we have to mention also, for the people who are in the financial bad situation, the government has been able also to give for free, energy, electricity to those families who are in low income position, to support energy sector during the 3 months of this pandemic period. This is some points I can highlight. But what I can say globally in this situation, I have to say, is there is a lack, of coordination of the interventions with the stimulus package or economic relief measure given by the government and the international organization and the national NGOs, in that situation. The lack of coordination was something that has been a situation where we cannot measure effectively how these stimulus packages and economic relief measures has been positive for the family. But globally, we can say that we have not so badly affected by the the numbers of cases of impact of COVID pandemic, that we can thank God that we are now in the recovery period and people are still going to continue their work. The school has been open now and the government still continue to support the people who are still affected by the multidimensional crisis facing Mali people at that time. Thank you very much.
Thank you very much, Mali. So the distance learning to support students, is it a government initiative?
Yes, it's a government initiative first, but also we have been, we get a support from the World Economic Forum with the Coursera, the Coursera online platform for learning, so that they give a space for the country, for the people who are in that situation where the school has been closed, to how they can, to upgrade their technical skills in the digital skills, also all of the skills they can need to be ready when the job market will be reopened in the country, to be the skilled people that can face the challenges they will be facing in the next step.
Okay, thanks for that clarification. So yeah, that was Mali. Quite a number of stimulus packages and initiatives from both international organizations and local organizations. But of course, as you've mentioned, the lack of coordination, which makes it difficult to measure the effectiveness of the stimulus packages. So we'll just move forward to Kenya.
Hello, Josephine, can you get me now?
Yes, I can hear.
Okay.
Yeah.
Okay.
Hello. In a situation, the government, together with the private sector, civil society organizations, and religious institutions, put in place measures that would at least support and cushion the communities from the effect of COVID. Workers were given tax relief, loans, and moratorium on debt repayment. The central bank ordered banks to waive bank fees for individuals who move money between their bank accounts and mobile wallet. Banks also increased the upper limit for mobile money transfers by SMEs. The Treasury announced a $5 million package to support the tourism industry, which was impacted negatively because, as a country, Kenya depends on the tourism industries. Hotels were closed, and artists had nowhere where they would go and perform. Commercial sex workers were also hard hit because there were no clients to support their services. Banks restructured debt to people and businesses facing financial instability due to COVID-19. A few landlords waived tenants from paying residential and business rents, while others offered the rent to be paid after others deferred the rent to be paid after 6 months. As an organization, we provided, that is the Movement of Men Against AIDS in Kenya, we also mobilized resources from our partners in Kenya and abroad and provided foodstuff, sanitizers, masks, and counseling services to various community groups and especially people living with HIV and AIDS because they were hard hit by the situation. And we also identified highly vulnerable households that were hit by the pandemic and supported orphaned and vulnerable children to access sanitizers, foodstuffs, and so on and so forth. Various community groups also mobilized themselves and mobilized resources, foodstuffs, and supported communities that were vulnerable. Politicians also chipped in with their support and bought foodstuffs to the communities affected. Online learning was encouraged, especially the connectivity. The government also initiated balloons that would actually provide internet services to areas where connectivity was low. Thank you.
Thank you. Thank you very much. So it was the tax relief and loans for workers and banks increasing the upper limit for mobile money for SMEs, and I find it quite interesting that tenants waived rent for business. I mean, not tenants, that landlords waived rent for business tenants, and also the support for artists. Was there also support for sex workers? You mentioned sex workers.
Sex workers were not supported as such, but they were impacted negatively because of the closure of hotels and entertainment joints. So they were actually bad hit.
Oh, okay. Then it means I had misunderstood. Also, for sex workers, it was like the how they were affected. Okay, thanks. That's clear.
Yeah.
Okay. Support from community groups, from NGOs like the Movement of Men Against AIDS in terms of food packages and masks for orphans, people living with HIV and vulnerable population, as well as online or digital learning. Okay, I got.
Yeah.
Thank you very much.
Okay.
In Zimbabwe.
Yes, thank you. In Zimbabwe, the lockdown started end of March, and in March, and the government unveiled an 18 billion economic recovery Zimbabwean dollars as a stimulus package for the relief of individuals, families, and small organizations and industries on the impact of the lockdown. And also the government introduced an exchange control regulation on the 29th of March 2020 to allow persons to pay goods and services chargeable in Zimbabwe dollars in foreign currency using their free funds at the rate of the day, and payment that was supposed to be done electronically or through foreign currency accounts or cash. Thirdly, the government also committed to provide assistance of 200 Zim dollars per family to vulnerable families for 3 months. That was, for 3 months. And then fourthly, the government also deferred rental and mortgage payments during this period. And it was deferred and then terminated by the 30th of June 2020. So from March to June, it was deferred, the mortgages and also the rentals. And in addition, the government also introduced radio and television lessons to cater for learners. These are some of the issues, but if Florence is there, maybe she can add one or two, but she's having challenges with connection, so she also gave your input in the chat box. Thank you.
Thank you, Zimbabwe, for sharing that. Before we hand over to our researcher to continue with the process, we're going to kindly request that we try to, in the interest of time, because the discussion still has to go on, we try to be as succinct, but also try to be as brief and to the point so that we can be able to engage with also the comments that are coming through from other participants. And we also request that one person per country responds and the other colleague tops up in the chat box. So if there are two representatives, if there are two panelists from a country, may one panelist respond and may the other panelist just add on in the chat box, and it will also be recorded. Thank you very much. I will take it back to Sibonelo.
Thanks, Piwa, and thank you, Zimbabwe. So we will move on to Sierra Leone. David, have you fixed your?
Yeah, thanks so much. Trust that this time around you are getting me.
Yes.
Okay. The government of Sierra Leone, through the National Commission for Social Action, which is a parastatal institution established to take care of social reconstruction from the post-war situation, it still exists. So the government made the two layers of support as a part of the stimulus package for people in Sierra Leone. First, they were able to identify and support financial grant to categories of business people, including hotels, traders, bar, restaurants, and those big institutions, financial institutions. Additionally, they're able to give a food aid to vulnerable people, especially persons with disability. And the second layer is that Bread for the World, which is a German institution, supports the Civil Peace Service, CPS, which constitute part of the Mano River Union countries through SLADIA. And they too have a consortium to which Men Against Sierra Leone is part of, and also distributing food items to vulnerable people. They are giving a grant of $400 to independent business actors like women, those that are in the market at the low class level. But they have recently gave $200, which is about 2 million Sierra Leone currency. And the second phase will be coming in April, second week in April. The provision and distribution of agricultural support materials in the provinces through other consortium network members like SILNOV and other organization, MADAM, in the northern part of Sierra Leone and some part of south and eastern region of Sierra Leone, including the SLOIC and the other institutions, YMCA, and all the rest of that. But one of the challenges, probably to summarize quickly, is that most of the business owners in Sierra Leone, perhaps as compared to other countries likewise, are predominantly men-dominated. So apparently difficult, if not impossible, for these things to reflect down to the actual women on the ground, the women and girls on the ground. Unfortunately, and as my colleague was saying from Kenya, we have no special package for what they call the commercial sex workers, because as an institution, I don't know for sure if as an independent people that were going out to register to be given either from the CPS network or from the NACSA distribution. But as an institution, the government up to this point of standing have not been able to recognize and give them. So there's a whole lot of situation that is affecting them. But our points of discussion with them last week was that they also constitute part of the Sierra Leonean society. So they should see every reason if they're supporting other people in agriculture, in grant for big businesses, for food support to vulnerable and people with disability. There's also a fetch need, operational fetch need for them to be considered. But that is yet to be discussed. That's a part of this week with SLADIA, which is the head of the consortium, and National Commission for Social Action, which is NACSA, with the Ministry of Social Welfare, Gender and Children Affairs. So that is a compact summary from Sierra Leone.
Thank you very much. So in the interest of time, I won't be summarizing what you just said. We will move on to the next question. To what extent did these measures, the measures that we just spoke about, take into account women and girls' realities, experiences, and unique needs, and also to what extent did the measures take into account the realities, experiences, and unique needs of men and boys? And we'll start with Rwanda.
Yes. Hello. Can you hear me? Yeah.
Hey.
So to this question, to what extent did these measures take into account women and girls' realities? Sorry, there's a lot of background noise, but I hope you can still hear me. well?
Yes. Yes, we can hear you clearly.
Okay, good. Yes, so after, I don't necessarily say we can be surprised that masculinities or men and masculinities resulted in the impact that we've seen in the aftermath of the very first lockdown, in terms of how many people were affected, with gender-based violence. And I was doing research back in August, and if I'm not wrong, we had about an average of between 500 and 800 people or teenage pregnancies in each district. Perhaps my partner can correct me on those numbers if I'm wrong, but that is a significant number. And obviously the same is also evident in other countries on the continent. And so what has the government done, or what have we done in terms of creating unique experiences for women and girls? If we look at, for example, education in this moment, indeed, boys are more likely to have an ease back to school in these scenarios. Obviously, teenage pregnancies cannot necessarily go back to school and have an ease with their education. And so I'm not 100% sure on what the government has done in these cases, considering we are still in lockdown and a lot of schooling in rural areas has been stopped and has really stopped for about a year now. And even in university, even from K through 12 in university. And so in regards to education itself, I don't think a lot has yet to be implemented, although I do not have certain specific comments on what they are doing at the moment. I think I can stop there. Perhaps if Anj has something to add, she may. I will say though, and boys, men and boys, I didn't answer that part today. We noticed a lot of people go back, a lot of teenagers go to find work after COVID, and so most men and boys are involved in going back to these daily jobs and trying to find work. And less, concerned about school experiences or education experiences. But definitely healthcare also is something that we can put into consideration, especially tied into COVID-19. Rwanda has reduced the cost to get tested. It was 50,000 Rwandan francs up until close to the end of 2020. It was 50,000 Rwandan francs, but now it's at 10,000 Rwandan francs, which is about $10 or $8, and the other one's about $51. And so that's something good that has happened, although that is still a significant economic burden to a great population to be able to afford $10 to spend on a test. But I'm sure, and I am hopeful that the government has been doing some free testing for people who are unable to do such. I will say also, I know this because there's been a reinvention of the Ubudehe categories. And I think this is probably the most specific point I can give, is the reinvention of Ubudehe categories, which is how the socioeconomic statuses in Rwanda are governed and how people are taxed and what kind of social benefits people get. And so those have been rearranged to fit the context of COVID-19 impact. Thank you.
Oh, okay, thank you very much. The other participant can always just type their contribution on the chat box. Let's move to Mali.
Okay, thank you for this question again. I can see that normally there is the government has not make any difference between the needs of the women men and girls and boys at the same time. I find that this is the problem we have in that response to the COVID-19 pandemic in activity. Everything is done at the same level. We have to bring that solution. We give masks to everyone. We cannot say that. At that point, I can say that we don't know how many women have been victim of COVID. How many men and how many women? We don't know exactly. We just know every day we have this number of cases, and this is the number of people who has been treated, and so on and so on. This is the number of people who has been died about COVID, but no information disaggregated by men and women. That this is one situation. And as you know, that in that country we have not made the images like International Men and Gender Equality Survey study before at the national level and also in that pandemic level to know what are the real aspects of masculinities we can address in that situation. So that I can say that they give, the solution they have, but not exactly to say that this is for men, this is for women. But when we see the activities done, by some young people, we see that young women and boys, as all of them are involved in preventing and responding to the pandemic, information and advocacy to see how we can wear masks and so on. But can say that in Mali there's no difference taken by the government of a particular supporting organization to say that this is the solution for women and girls, and this is another solution for men and girls. There's no difference.
Thank you. We move on to Kenya. And remember the 3 minutes rule.
Okay, thank you very much. I would also want to say that we'll need to do probably a study to actually identify how the stimulus package measures impacted on both women and girls and realities and unique needs of boys and men. Though the packages were felt by both men and women, but more so on women and girls who generally earn less and save less and fewer jobs or living close to poverty. Why? Because one, when you are given tax relief, especially when you are looking at a situation where COVID has impacted in job losses and both in the households of the lockdown, at least this reduces the stress on in the family kitty and the tension within the household is reduced because the landlord is not demanding for rent, or the schools are not demanding school fees. So the little resources that a household is having can be used either to take care of a sick one who is in hospital or for other needs that the family would require. Another concern would be because women are generally in the forefront of the COVID pandemic in terms of providing care, especially in hospitals. You find a lot of the staff are women, and in a situation where the government is unable to supply them with the required provisions like the PPEs and so on and so forth, and even medical cover. It affects them very, very much in terms of taking care of the sick who at that particular time need that care. And so you'll find that in Kenya, it reached a point where the medical staff had to be forced to go on strike. And this was not good because patients require the services at that particular time. So I think I'll stop there. And I say we need to look at the measures of the impact of the packages.
Okay. Yes. Thank you very much for that response. And Zimbabwe.
Yes. I think we need to acknowledge that maybe there was no disaggregation in terms of realities of both men and boys, women and girls in terms of what the government provided. And we acknowledge the stimulus packages that they gave, particularly to the vulnerable households. But I think we need to have a more sustainable solution rather than short-term provisions, because this was for 3 months. And I think in addition to that, we need also to see the different realities, because when like others are saying, when we have a pandemic like this, people are not going to be affected the same way. The issue of care work, the issue of household chores, even some of the innovations, the things of online learning. You realize that parents had to start buying gadgets from maybe the budgets that they didn't have. They are now looking for budget lines to buy the gadgets for them to go. Some could not even afford the online lessons and the radio lessons and the TV lessons for them to be able to watch. The issue of electricity rationing and cuts also coming into play. So you realize that people in different communities were then affected differently. So I think more sustainable and more robust thought through processes in terms of these measures needs to be done to be able to have cushion both men and boys and women and girls at the same way. But we acknowledge that the measures that were given were okay, but not complete to meet the needs of the different groupings. Thank you.
Thank you very much for your response. And Sierra Leone.
Yeah, thank you so much. The stories look very closely the same. In Sierra Leone, the distribution, I'm not quite sure if the government really took into consideration the issues of women and girls in practical reality and men and boys. What I saw, because we gave some staff to be part of the SLADIA and CPS contribution and donation process. 2 females were assigned there. What I saw was initially the first lady of the state was giving out what they call sanitary kits. It's a package to girls that are going to school. Remember when there was a lockdown for 3 months after schools reopened, and the distribution process from NACSA, from CPS and other parasita institutions that government set up started going into various institutions. So the only exception I think was the giving of the sanitary kits by First Lady from her project, Hands Off Our Gas project, that was specifically for girls. For this food supply, I think it made some relief for some people in the homes, because we all know, and that's the practical evidence, that women fetch, they support, they prepare and take the brunt of the responsibility in keeping the home. So with the support of the small food in the various homes, although it's not sustainable, as my colleague was just saying, but it helped to reduce the psychological impact on the women, because in most cases, especially in Sierra Leone, when there's no food, there's shortage in the home, the women are the ones that suffer more, because the children hang on them. Even with the adults, after work, when we go home, we expect them to prepare food for us from whichever source. Very few people would not would like to know. Others don't care. All what they know is they should have food on the table. So those things we are not giving consideration. The other thing we saw was it was not the measure did not take into account the various realities and the spaces for the women, men, and boys, because during the distribution process, people with disability, lactating mothers with children at their back, squatting, especially we are in the middle of the dry season. The place was terribly hot and they have squeezed, the children are crying. There was a lot of social inconveniences, which didn't really go well for me. They would have organized it better. It could have been better organized that way, especially where you have the old people, men, old women, and everybody was verified after the registration verification. Everybody was requested to go to one of various distribution centers without specific layout, taking into consideration the specific need for girls, for women, for men, and boys, for the people with disability, and school boys and that kind of stuff. So for me, on the average, there's much we need to learn from it. And I think we're trying to send up a recommendation after the first phase of the distribution as part of the process to tell them that this thing, even though it's good, it went some way to help people, the families, the men, because it helped to subsidize some of the support to the home and other things, because jobs were cut off, everything was at a standstill. There's an augmentation in the process of support in the various homes. But we believe passionately that it could have been better organized to make sure that whatever little package or quantum that is meant for people is being given. Because you have these sidewalk boys finally standing around there when you take the food and keep it there. These old people, you see people rushing from nowhere and just grab the carton or the bag of rice or the oil on the tomato and cubes or whatever, salt and all those things. So there was some kind of rambling, fighting to make sure that everybody, the little you got from the government or the other institution, they're able to take it home. So it was like most of our women and guys, especially lactating mothers, the old aged and others, were found between the devil and the beast. So
thank you very much, Sarah Leone. We will move on to the next question and we'll start with Rwanda. So what impact do you think the stimulus packages have on gender relations and on gender-based violence in your country? And specifically if men and women... Hello? Is there someone who's talking? Okay. So specifically, I would like to know if men and women have been affected differently in terms of gender relations and gender-based violence. And we want specific examples, if you have any, of how men and women have been affected differently in terms of their gender-based violence and gender relations. So I'd say that we'll start with Rwanda.
Thank you very much. On this question, asking about the impact of stimulus packages on...
Sorry, can you, please increase your volume? Can hardly hear you.
Do you hear me now?
Yes, thank you.
Yes. On the impact of these stimulus packages on gender relations or gender-based violence, I think on these the operations of these commercial services, women learning these small commercial services, they went back to their duty, and you find that in some home, when men were private or public service servants, there was a restriction that the public and private sector would use 30% of its workers. That means that some will stay at home and others go back to work. With that effect that I said it was positive of this COVID-19, some men learned to do unpaid care works home. And when they would not go for work, for office works, and they work from home, when the female would go to learn just their day-to-day small commercial services, the men should take care of these unpaid homeworks. And I do think that the operation of some services led to improving this good understanding of the gender equality in some households. And another impact that I see is that after the openings of the cross-border cross-border trade, especially in Rusizi and Rubavu districts of Rwanda, of the Western province, there is a large number of female, yes, women in cross-border trade. And when the work was resumed, yes, women, they went to work, and other women who did not want to take like advantage to be bread givers in their household. There was an improvement in the understanding that they should do like a small business to provide for their home. Hence, it reduced female dependence on men and the provision of needs for the family. And also another impact I saw that I realized as an impact of these stimulus packages, I say that there was provision of income generating activities to female victims of gender-based violence. It showed a good picture in the community that though girls have experienced gender-based violence or are victims of are victims of the gender-based violence, or they are like pregnant mothers, there is still hope that someone could see good in her. If the government institution or the non-governmental organization, the civil society, decide and take and help your girl to continue living, this shows parents that though she had a problem, but there is still good in her. And also another thing in the social protection, civil societies also helped girls to go back to school. This gave image to parents and the whole society that though the girl was pregnant or had been impregnated, but she can return back to school and resume her studies. And after she can be a great woman, she had already been dreaming to be. The stimulus packages, as we mentioned, and the Rwandan context, they have had great impact on both. Yes, when we say a family, there is men and women. I don't see a specific impact on men and on women, but I see there is a general impact on the society. In brief, I can say that's our Rwandan context. Thank you very much.
Thank you very much for giving that context. And Mali?
Thank you very much, my friend. I can say that, honestly, in the country, we have not conducted any impact study to see what the stimulus packages has affected the gender relations and the gender-based violence. As I said that during the work done in 2020, we have continued to make advocacy and prevention activities, to continue to make people wear masks and to respect this social distanciation ways, so that we can reduce the number of cases of COVID-19. What I can tell you at that point, the measures I told you about, giving the guarantee fund about 20 billion our national currency, has been stopped by the government because of lack of funding. because I told you about the bad political and institutional instability we have now, and most of the funds have been reaffected for security and peace activities. This is one point, and I said that also the government is still trying to now to bring new new stimulus packages and economic relief services in that situation. Now they decided to postpone the payment of the fiscal duty for small enterprises. That's something we can have. But about the case of GBV, I noticed that, as I said at the beginning of my speech, right now for this question, we have not conducted any specific result in evaluation to know that what are the stimulus package have made in the country. As I said, there is a lot of interventions, from the government, for international organization, for local organization, from individual people, so that we don't know exactly what has been made, and the lack of coordination is something very difficult to make us measure the results of that mission. But what I can say that right now, the people are still doing their activities as normally. I can say the school has now reopened, and the activities, cultural activities, are still going on, and the sports activities and collective activities have been running again. So for me, I can say that we need to continue to see how we can work together to measure the impact of those activities in the country as well.
Okay, thank you very much for that. Yes, definitely an impact evaluation, an impact study would give more information. But thank you for sharing, and colleagues, do share from your experiences, from what you've had, even if there is no impact study that has been done. If there is an impact study that has been done, please do mention it in your response. But if it's not there, just share from your experiences, from the information and knowledge that you have on what is happening. So we will move on to Kenya.
Okay, thank you again. I would say the impact of the stimulus supported the reduction, like I had earlier on indicated, of psychological stress related to unemployment, and especially more so to men and boys who are usually seen as breadwinners, and they were able to be supported psychologically. Hello? Hello?
Yes, we can hear you.
Okay. I'm getting a background noise from your side. I don't know what's happening, but let me continue. Men who usually the main breadwinners were able to be cushioned by the relief on paying debts, taking care of the family, the food distribution also supported the psychological stress that is experienced by women, and it also supported the pressure of paying business rent and also household rent. Girls and women also supported, who benefited from the stimulus package, were also supported in terms of exposure to HIV, since they could not go out. Sometimes when the situation is normal, you find girls or even men going out to entertainment joints to do commercial sex work. But as stated earlier on, the social distancing had different impacts on both women and men in relationships, because you'll find that commercial sex work was reduced because the government was saying that people needed to keep social distance, and you cannot keep social distance when you are doing commercial sex work. Sexual relationships or even within the household, like sexual intercourse, was also reduced because the families feared that one could contract COVID through that closeness. The public transport, which is actually also managed more so by men, was also hard hit because of the social distancing factor, because you could not carry more passengers, and that meant that you as a business you would incur losses. There was also reductions of cases of homicide and decreased cases of suicide because of the stimulus packages provided by the government, especially to business people who were faced with closure and even distraction because of the situation as it is. Thank you.
Thank you very much for sharing that. Zimbabwe?
Yes, we still definitely need to have an impact assessment to see the impact of this really. But some of the examples that I can give off the cuff now is that with this lockdown, you realize that most companies and industries are closed. Like right now, the only facilities that are open are government departments, supermarkets, and pharmacies, and that's generally that's all. And of course, people maybe around the farming communities, farmers, and people in mining. But besides that, we realize that everybody is at home, so there is also maybe some people will definitely lose their jobs, also revenue. And we realize that the economy is mostly supported by informal, so that the informal are not able to do their work. They are at home. And we're looking forward, maybe on the 15th, maybe we're going to have some of the restrictions taken away so that people can start and the economy can start moving again. So these are some of the realities that are there, affecting people. Schools are still closed, but those maybe in towns that can afford and are having online lessons can have that. You can't have one-on-one lessons. Even some places where people would go, churches. It has changed a lot in terms of gender relations and also social relations that people have. Funerals now, in less than 72 hours, someone has to be buried. So we really need to see the impact of that in an impact study. But a lot of things have been shifted because of the pandemic and the perceptions, and some of the things that people used to hold dear have been challenged and changed. Yeah, so these are some of the issues, and we know when this happened, the intimate violence, like I shared before, has increased. But also we are going to miss some girls going back to school due to pregnancies. It happens during times like this. So these are some of the realities and examples of what's on the ground right now. Thank you.
Thank you very much, Zimbabwe, for sharing that. And Sierra Leone.
Yeah, thank you very much. As colleagues have said, I just want to highlight a very few things. Because of the lockdown, which, for instance, our own lockdown, the second phase of the lockdown just ended this Sunday. So a lot of other difficulties arose out of it, as they have been before from last year, since the outbreak of the pandemic. We have not made actually a full impact assessment because the process is yet ongoing. But from the practical evidences available, as we see, when we get to communities, food is very expensive. Majority cannot afford to buy food, as my colleague was saying, from supermarket and those big shops and other things. And because of the continuous lockdown, inter-district and blockade and other things, the food production from the local communities which supply the major cities are embarrassingly slow, and therefore the few that can be found in the market are very expensive and difficult to cope with. So on the gender aspect, you will see that women suffer a lot of this economic pressure, because whatever be the case, at the end of the day, they are the people that are responsible for producing and providing for the families at whatever expense. Unfortunately, even though the money or whatever is given for food preparation is not enough, so they have to play what they call a market magic, as we know now in Sierra Leone nowadays, because you give a very small money and you have 4 or 5 or 10 people and you want your wife to cook adequate food that can at least be enough for everybody. So where does he get the other excess from? So only God can tell. So these are some of the difficulties actually that is happening in this lockdown systems. And the other aspect of it is goods and services are very expensive, because if a lot of other people, when they talk about lockdowns, travel is restricted, the very few vehicles or trucks or goods suppliers have to go and take what they call a pass, and that process requires a whole lot of time, swapping and other things, analyzing and see if you are COVID free. They give you a certificate, and all those things buy a lot of time. Quite recently, there was a very big upheaval at one of the major checkpoints into the city, where over 400 trucks were held for over weeks because of the lockdown, and a lot of goods and other owners were grumbling, and it became a very serious issue that they took up to State House, because all their domestic food that they brought from the provinces were stuck there. The lockdown met them there. So it's a whole lot of embarrassment. And the only aspect, the additional aspect I see is that because the little support that they gave resuscitated some business to some extent. So I think for some men, it helped them a great deal, and also have an impact in some relief for some families, especially the heads of recipient families that received a little token, either cash or food. And it also helped to control some kind of family networking, because now that majority of the men, because of the constant lockdown and the pandemic and those institutions, majority of the institutions are closed, especially factories, mining areas, and so forth, then automatically those men who otherwise would have been on the work field are all at home. So some men, like the few I see around me, have started giving support to their wives in terms of childcare service support. Have our child, let me go to the market and try to do some small domestic work, which before now was never possible. So some have started sharing, but that cannot be accounted for in a large scale, because we've not done the total run over to do what we call the impact assessment. And lastly, I think one of the things that is happening is there is also need for us to do complete impact assessment, so that at the end of the day, we do it in 3 phases: one from the city, one from the mini situations where you have fairly big towns like district headquarter towns, and one from the remote rural settlement, how to reach areas, so that we can compare the 3 analysis and the data, and we'll be able to come up with cross-cutting information that can provide a balanced look at the situation, not only from the municipality or from the country capital, but we'll also get out to the district. We can also get out to the chiefdom headquarter town. We can go to section towns and villages, not all, but have a specimen sample, random sampling in terms of research. Then we'll be able to get a better picture of what is going to happen and what the impact, whether it really spill out to those far rural, difficult to reach and underserved communities, or it's only from within the cities, provincial headquarter town, and district headquarter town. As it is now, we cannot ascertain actually what the reality is, except perhaps when the situation is gradually reducing, they will be able to apply to some of these areas, and at that time we'll be able to give you more comprehensive details. But so far, that's the one that we can get. Of course, the IPV, which is the interpersonal violence, is still on the increase, because some areas, most of the people are not able to get, and they say the hungry man is an angry man in Sierra Leone. That's what they say. So it's difficult for them now to have fun. It's difficult for them to share. So every little thing is being aggravated. So we are looking at things, but I think with time we'll be able to get out there and to give a complete story.
Okay, thank you very much for that response. So what I'm going to do is that I'm going to try and tie question 5 and question 6 together in the interest of time, but also in responding to the previous questions. Some of you have already touched on what worked and what didn't work in terms of the stimulus packages. So now I'm going to ask that we respond to this as our last question in terms of any recommendations on how stimulus packages or economic relief measures should be implemented in future to promote gender equality and to minimize the impact on GBV. So any recommendations that way you have in that are obviously based on what didn't work out well, and what are the recommendations that you are giving so that can be improved in future to promote gender equality and to minimize the impact on GBV. And we are just moving in the same way, Rwanda.
Hi, so thank you for the call. I greatly enjoyed this conversation. And my recommendation, or what I've seen, is to engage the entire community in social discourse on various subjects, and not, from gender-based violence to gender equality to how, education reform and so many other things. I think that this pandemic has shown that each one of us can be a contributor to the greater force, and I believe that to be able to engage each citizen in economic implementations and political discourse is something that, as Africa and as Rwanda, we absolutely have to work on. I will say, as a result of the pandemic, we've seen many stories of even, children falling out of school. Indeed, the previous speaker mentioned suicides because of either teenage pregnancies or just something has gone wrong during the pandemic. And so to be able to allow these platforms or this engagement on family and social level is a way that we can positively move forward. Thank you.
Thank you very much, Rwanda, for that response. I am just going to check with our research. Sibonelo, are you able to hear us?
Okay, I was on mute, sorry.
Thank you.
Thanks. Yeah, so I was saying thank you, Rwanda, for the brief response. Can we move on to Mali, and can you also be brief? Any recommendations?
Thank you, my friend, for your moderation. So I have 5 recommendations we can take in account on that stimulus package and how we can mitigate the risk of COVID-19 on gender equality and women's empowerment. First, we need to amplify the advocacy and the partnership between the government, international organizations, civil society organizations, and also international donors to raise resources, to mobilize resources, and to develop this kind of specific and standard stimulus package we can bring to families and to communities to overcome this pandemic challenge. The second recommendation is about the coordination among the institutions who are working on that, preventing and responding to gender equality, who has been gender equality and GBV, who has been raised by the COVID-19 situation. The coordination is something very important so that we can be able to be efficient in the resource management and to target the main the beneficiaries for this activity. The second thing is about communicating again about the risk on the gender-based violence for that pandemic situation. So we need to engage more young boys and young girls in the prevention and sensitization activities across the country, both at rural and citizen level. And we need to think at the fourth recommendation about the post-COVID-19 recovery period, how we can engage more in the developing innovative and responding activities and the strategies for GBV and also for SRHR activities in our countries in Africa. And lastly, which is not the least, in the pandemic situation, we need to think strategically and tactically how we can develop women economic activities, women empowerment, economic empowerment activities for women and girls in that situation. Because when we are not working before the pandemic to have a lot of women having jobs, having access to resources like land, like financial resources to develop their own business and to be economical and financial independent, that can be difficult when we have this kind of COVID-19 situation. They will be facing, at risk for gender-based violence and SRHR, activities. So we need to think how in our activities as gender equality institution and organization, how we can rethink and react, strategical and the women's economic empowerment activities. Thank you very much. These are the 5 recommendations I can make for you and for the community of gender-based violence activists and institutions. Thank you very much.
Thank you very much. And Kenya?
I would say that in Kenya, what we thought was important was that providing telecounseling and support enable the communities to deal with issues of stigma, plus the strategy by the government of giving information on transmission and prevention of COVID also enhance awareness of the same. I also think that putting people on quarantine was not done appropriately, since a lot of people are forcefully being quarantined without being a threat to their families or the larger communities. The government should also be prepared for pandemics and also issue practical and realistic advice on the same. I also think that the government also need to make provisions for standard health services to be continued, especially for sexual and reproductive health care. Particularly, attention needs to be paid to healthcare services for older women, gender-based violence survivors, as well as antenatal, postnatal care and delivery services. The government should also pay explicit attention to the role of women as frontline health care workers. The special attention needs to be given to the health, psychosocial needs and work environment of frontline female health workers, including midwives, nurses, community health workers, as well as facility support. Thank you.
Thank you very much for that response. Zimbabwe, any recommendations?
Yes, we recommend that I think government needs to come up, governments need to come up with some budgets really for emergencies like this, because I think some of the things that started happening, it was because maybe there were not enough resources to cater for this, and also a plan, a comprehensive plan that includes nearly every sector, civil society, government ministries, and nearly everybody to come up with a way of strategizing and how to come up with these strategies, because you realize that when lockdowns came in most of the African countries, then all of a sudden there were supposed to be stimulus packages, and if they were not budgeted for, then everybody started running around trying to look for resources to cater for this, and there were not enough. Resources sometimes are not always enough. So there needs to be a plan, like the example that we gave, that the stimulus package were for 3 months, but the lockdown now started in March last year, and we're getting to another March, which is a year. So how do you go around, things like that, So I think there needs to be some strategies that needs to come into this and take this as a learning way and see how even the health system needs to be strengthened, need to promote issues of testing, just like this time. It's still costing $60 to get tested. And I know I have heard that there are now some places that can test for free. But these are some of the challenges, that are there when an emergence comes and there was no emergence plan for those things, then it can affect a lot of things. Thank you for that.
Thank you very much for that response. And Sierra Leone?
Yeah, thank you so much. We have about 3 more suggestions in addition to what our colleagues have given. The same thing, disaster or preparedness plan need to be put in place by government for more attention to be given. For instance, we have the experience from Ebola and this corona, where quarantine homes or isolations were not given food on time. So at the end of it all, even though the measures are very nice in put in place to make sure that they curtail, but because of inadequate supply of food to those quarantined homes, you can see that those people who have been medically proven affected have to sneak out because whatever happened, they have to look for food. And when they get out into the wider community, they get other people affected. And that's institutes one of the reasons why you have these fluctuating figures around in Sierra Leone. So we are strongly recommending that disaster preparedness plan need to be put in place with that kind of contingency, that if it requires quarantine or demarcation or lockdown, something should be there to subsidize for those people under curfew. Then also 65% of the support need to be given to women, simply because in most cases, we are saying that at the end of it all, women have the bulk of responsibility to take home. They take care of the children, they take care of the sickly, they take care of the aged, they take care of even the well-to-do husbands, wife, brothers, and cousins. So at the end of it all, they are going to make it very uniform, wherein everybody gets the same right. It is also possible that, as we are seeing from practical experience from the field, majority of the men, though not all, majority of the men sometimes do away by selling the food and other things, and the shortage comes in the home, and the women suffer together with the children. We are also recommending that those strategic distributors make sure that if there is any outbreak or anything of that nature, each institution should be given a specific category to work with. For instance, if the one organization, like in the consortium, can deal with only pregnant women, the other one can deal with lactating mothers, the other one can deal with the sickly or the aged, the other one can do with women. At the end of it all, you will see that those categories of people will not face a lot of difficulty, as we saw in the distribution, because where you have the pregnant women, women with children on their back, lactating mothers, the age, everybody is bundled together at one distribution center, and they are squatting here and there, people squeezing, a lot of embarrassment, children are forced, the women have to drag out their children from the hot burning sun and all those kind of things. I think some of those things can be minimized. And the last one we are saying for the fourth is that to make sure that when those plans or emergency surface, as we learned from Ebola and this coronavirus, those kind of best practices can be documented. We also expect that, because we saw in Sierra Leone when the coronavirus issue came, they sent out for those guys who were functionary in the past Ebola venture to come and share their experiences. What we are recommending, that is fine, we have no problem with that. But what we are saying here is, if all the work done during the Ebola scourge, during the mudslide and other things, those information were documented and kept on file, it will be very easy. It will serve as an archive, as a term of reference area for the government to go into it in case of any backdrop of eventuality of similar situation. What in case you needed the coordinator, the director, whoever, he or she is not located. But if you have the document, it serves as a guideline. So these are some of our recommendations from our side from Sierra Leone.
Okay, thank you very much, Sierra Leone, and thank you very much, everyone who participated in this discussion. It was very, very informative and very interesting. I'm just going to hand over to Mpiwa.
Thank you so much to our panelists for a very robust and informative discussion that we have had. And also to apologize that we have stretched over time, but that is because of how robust, it just shows how robust our conversation was. And I also am cognizant of the fact that a lot has also been shared in terms of in the chart, that is to support some of the information that the panelists have shared. We have countries such as Nigeria. Nigeria has also been able to share their experiences, and they've explained that COVID-19 affected women and men and it also greatly affected key populations. The lockdown resulted in them not having access to health services. This resulted to risky behavior, increase in mental health issues, drug use, dependence, sexual violence for female sex workers. There's been an increase in gender-based violence. And there's also another participant who shared around how people have been frustrated. I think there's also that dimension of mental health issues, how this process, how COVID-19 has had an effect on mental health, and how it has also panned out, with an example being given in terms of how young people have been frustrated and angry, and how young people also took to the streets in Nigeria in what was popularly known as the End SARS movement, which, while was addressing particular pertinent issues, was also a demonstration of the frustrations that people have had. There's been a reported increase in rape cases, and there's also been echoed. This has been echoed by many countries. Burundi has also shown, I think Burundi gave an example of the dimension of the gendered nature of COVID when it talked about how people were forced to stay at home. And to quote, it says, forcing a Burundian woman to stay at home is to deprive her family of food resources. So when we're talking about some of the gender dimension, like was shared earlier, the effects of that, the threat to food security, then we see that for livelihoods of families that are dependent on selling food, on informal trading, this had a serious adverse effect. And who is more involved in informal trade? We know that research shows that women are more involved in informal trade than their male counterparts. So the quote from Burundi captures how the curtailment of movement as a way of addressing COVID, how it impacted on the informal sector and its gendered nature and effects in that regard. And also countries like Zimbabwe added that there's been increased basic human rights violation in regard to access to clean water, a situation that has seen women and girls spending more hours queued for water at public water points, and these have turned into a hub of violence targeted at women. So that they also continues to demonstrate that gendered dynamic, to say, while all may have seemed like it's easy, let's stay home, let's wash our hands very frequently and sanitize, but there was an implication in terms of what does it mean to wash our hands often, who has to get the water, who has to bear the brunt of taking care of kids when they've been lockdowns and not going to school, and so forth. And Malawi also shared in terms of the spike that has been experienced in terms of teenage pregnancies, because the reality is that with going into COVID, there's restricted movement and young people could not have access to SRHR services, and which has also resulted in girls being in a spike in teenage pregnancies and unplanned pregnancies. So these are some of the, thank you so much to our participants for adding on to this conversation and showing that and demonstrating that there has definitely been a gender dimension to this process. The pandemic, as someone said from Eswatini, the pandemic certainly brought about a huge surge in GBV, from rapes, femicide, forced marriages, infant mortality, and teenage pregnancy rates rose inexplicably. And we have heard that while our countries went and took different measures in order to address the situation, different stimulus packages were put in place. But however, the sentiment is that they still were not able to adequately address the need. They were still not able because, and particularly from a gender dimension, while efforts were made to really try and cushion citizens and cushion people from the adverse effects, the reality is that there were still some gaps, and the people who felt the brunt the most of those gaps are mostly women and girls because of their the vulnerable position in which they already occupy in society, and the unequal power dynamics, which in a pandemic are exacerbated. And we have also had a number of recommendations that have been prepared, that in times of pandemic, there's need for adequate preparation, there's need for impact assessments. These are some of the recommendations that have been coming up and that have been made by panelists and some of other participants on this platform. And it is unfortunate that in the interest of time, we are not able to fully open up the process, but I would suggest that if there is anyone who has a suggestion in terms of recommendations that they would like to make, if you could kindly type in the chart some of the recommendations, because this will come in handy. We are in the process as Sonke Gender Justice of developing this research, and some of these recommendations would come in handy as when we share the findings, which can also be presented to our governments and to our decision makers to say these are some of the issues that need to be tackled going forward. This is the reality and this is the picture. But to say definitely there is still need for us to continue to assess and analyze the impact that COVID is having in our lives, and to be also cognizant of that gendered impact and that gendered lens that comes with pandemics, as we saw with other pandemics like your Ebola. We've seen generally how crisis adversely or affects the most vulnerable in society. But that is not to forget that this has also had an impact on men and boys, the mental health issues that have taken their toll, and the challenges that have come with all the other threats that the pandemic has presented. So thank you so much for being able to stay on until the very end. And if you have any suggestions and recommendations, as I requested, that they could still be put in the chat before we end this meeting. Thank you very much. Thank you to our panelists for a very informative session, and thank you to our researcher for leading this process, and thank you to all the participants for the conversations and the contributions that you have made. Thank you.